My name is Keith Gallagher, and I am an assistant professor of psychiatry at Yale University, and also I work as an attending psychiatrist at the Connecticut Mental Health Center.
Okay.
I am Dr. Carmen Black Parker. I am also assistant professor of psychiatry and Dr. Gallagher's colleague at the Connecticut Mental Health Center.
My name is Rhonda Caldwell. I am a lead organizer and director of Hamden Action Now. We're an activist group in Hamden, Connecticut. Our mission for our group is to bring equity and justice to the Black, Brown, and Indigenous community of Hamden, as well as Connecticut. We're here to discuss today the issues regarding CMHC, which are considering to bring in additional security measures to their New Haven facility, in which Hamden Action Now and our collaboration group is fiercely opposed to it.
Now, before we go further, can you tell us what CMHC, can you tell us what that is?
Right, it's the Connecticut Mental Health Center. It's a part of the DEMIS agencies that provide mental health services for the community. And they're located in New Haven, across the street from the Yale New Haven Hospital.
And what is the plan that they're implementing that has you so upset?
Well, the plan is that they seem to want to try to address some sort of fear. There hasn't been any issues. Let me just say that there has been no incidents of any kind of shootings or anything like that that's happened, or stabbings, nothing that's been notable that we know about. But they're wanting to try to preempt some of these issues that I guess that they are seeing in all around our country. But you can't, we know that we're all in danger. I mean, danger is all around us because of, the gun laws that are present in our country. So I think by adding more security in these Black and Brown communities to facilities where people are supposed to be receiving mental health supports is problematic. I specifically know this to be true. I work in a state office and we don't have any of it. And I think that in all the state office, if you're going to bring a conveyor belt and an x-ray machine similar to what's at the prison, then that should be at all state offices, because I guess we're all in danger. But for some reason, they already have, a policy that now that if you refuse to empty your pockets and empty your purse and run it through the scanner, now they have a right to pat you down. And then if you don't pat down, they have the right to call the police, which are, armed with lethal weapons. And we know how well that goes when Black and Brown folks have the police called on them for trivial issues. We're seeing it on this George Floyd trial. So we see it on all of these issues. You had Freddie Gray, who looked at the police the wrong way and he ended up dead. We had Sandra Bland that didn't even put on her blinker. She's dead because people are calling the police on trivial issues when they should be concentrating on homicides and rapes, and so we're fiercely opposed to this policy.
Now, we are talking about a mental health center, and quite frankly, I agree with you. And there are reasons why I doubt if any Black or Brown person would not agree with you. But we are talking mental health, and we do have a lot of people out here who, in a heartbeat, will commit violent acts against people. So while I agree with you, what should be in place to ensure that the people who are seeking mental health treatment are also safe?
So the first thing I want to say, I would love to give the evidence, the academic literature behind that. There's no academic literature anywhere in existence that states that people with a mental illness are more likely to be perpetrators of violence. That is a stereotype that has been perpetuated in the media. Every time there's a shooting, they want to say did they have mental illness? But hatred is not a mental illness. I do not treat in the Diagnostic and Statistical Manual of Mental Illnesses. Hatred is not a diagnosis. So I want to be very clear that I am proud to serve clients with mental health considerations, many of whom have racial trauma that need healing, many of whom have police trauma that need healing. We are in the positions of healers, and I am glad to serve. We do not serve a violent population such as the media would portray. That is the evidence to that.
Now, Rhonda, when I read your email and it contained a letter, you were talking about the fact that other mental health facilities surround in the same area where this mental health facility is located, that they do not have this type of surveillance protection, these protections in place. Now, do you know that for a fact, or is that just something you're hearing, or do you know that for a fact?
No, what I was referring to is other state facilities.
Oh, okay.
I was saying other state
Okay.
offices.
I
Again,
got
like
you.
I work in a state office and visit our state offices in Hartford, and we don't have that level of security. So, it's the stigmatizing of, mental health that I have the problem with. I mean, this is, and the stigmatizing of it is what prevents people to want to even seek treatment. If you're stigmatized as a dangerous criminal type of person, people would prevent them. It becomes a barrier for treatment because you won't go. And it's just, I mean, to add a conveyor belt style of screening, it's excessive for a facility that hasn't had any incidents.
How long has
I
how long
mean,
has the facility been there?
CMHC, I believe, has been here since the 1950s. Don't quote me, but it's
Okay,
been
so
around
it's
for a while.
it's not something that's just opened up in the last couple of years.
Yeah.
It's been there for a
And to
while.
answer your
No.
prior questions, as far as a
Years.
conveyor belt with prison-like, security-like, TSA, the only facility in the state that has an actual conveyor belt where you must empty your pockets and scan is Whiting Forensic Hospital, which by definition serves the mental health needs of people with a carceral history. So those are pre-trial, awaiting trial, trying to restore their mental resiliency before trial. It is for that population. CMHC does not specialize. I'm an outpatient psychiatrist, the same as if I were opening a practice in Guilford. I am not a probation officer. I am an outpatient academic psychiatrist.
Rhonda,
Yeah, and can I just add to
Sure,
that?
sure, go ahead.
To give a little kind of context. So all throughout my training, I've worked in various different settings in psychiatry, and I can only remember seeing kind of scanning conveyor belt sort of equipment again at forensic inpatient hospitals, similar to what Dr. Black mentioned at Whiting, which are, for folks who often have a history of violence and an acute mental illness that does not allow them to be treated safely in the community. So very different from outpatient community psychiatry. But, I've worked in Veterans Administration hospitals. I do not recall seeing any scanning equipment there. I worked in a community mental health clinic in Baltimore that also did not have any scanning. There was a security personnel in the lobby, but it is something I haven't seen too much outside of the acute forensic inpatient hospitals.
So what we're saying in unison is it's not standard of practice.
Right.
Which is, I guess, why Rhonda is so against this, because it indicates, as you said in your email, just further control over minority communities. It seems that is what this is all about. Can you explain to me what you mean by that?
Well, it's just, we're back to, minority communities being perceived as being dangerous. And then you layer it with mental health and mental illness. We're back to the stigma that we are present with in our society, that Black people are dangerous. They should be feared. And if you're mentally ill in a white community, you're not as feared. That is the bedrock of white supremacy. I mean, we've been living with the criminalizing of Black and brown bodies since Reconstruction, and now we do it and we cloak it in. Oh, we want to just make sure we're safe because they're shooting in a grocery store and they're shooting, at a movie theater and a shooting at an open air concert. It doesn't even hold water. Like, it just doesn't even make sense. And so, I contacted uh, Commissioner Rittman, who is, the Demas commissioner, and we spoke. And she said at that time, when I spoke to her over the weekend, that this policy, while it was scheduled to be rolled out on the 28th, it's not in stone yet. And I believe that there is a meeting scheduled for tomorrow internally.
The
Now, for the
28th of
public,
this month, the 28th of this month of April.
yes. And so, I would love to, I'll find out, obviously everybody will tell me what happened after, but our coalition is fiercely against stigmatizing Black and brown people with mental health as being violent. And when you increase these measures without any sound explanation or any kind of, research that says that this, we're all unsafe, James, really. I mean, you're not safe going to the grocery store. I'm not safe going to work. My daughter's not safe going to a school. So, I mean, are we going to bubble wrap the whole society and say everybody stay home because we're afraid, or do you want to do this because you feel that there's a heightened sense of fear in a Black and brown mental health facility, and it's justified by taking Connecticut state dollars and throwing it at it? It's problematic.
One of the things that got me in your letter was this was supposed to be, or this plan that they've come up with is supposed to be an effort to be anti-racist. So I'm wondering, what is the makeup of the people who came up with this plan? Because it just seems a little insensitive, a little crazy that you would have African Americans who are part of making up this plan, and that they would not see the outcry that was going to come as a result of it. Do you know the racial makeup? It's a terrible thing to say, first of all. It's a terrible thing to say that you have to ask what is the racial makeup of the group. But in this particular case, it just surprises me that no one but an advocacy group has come and said, this doesn't smell right. So do you have any idea of who is coming up with this plan?
Yeah, I know that the information I received, it was Dr. Michael Sarniak. He has been, and I believe internally there has been discussion saying this is going to be problematic, and people are fearing, getting retaliation and losing their jobs. I mean, nobody wants to be out of work in the middle of a pandemic. You don't need people to, kind of try to retaliate and say and find ways to, have you be removed from your position. Nobody can afford that. But these folks are taking a great risk of their own personal income because they realize how troubling and problematic this measure is on their patients who are already dealing with trauma.
Do you really think that people's jobs are at stake if they rally against this measure? Do you really believe that?
I mean,
I've
if the
had
leadership
private
says yes.
I've had private conversations with people who are very much fearful to join the efforts against this because they don't want to be labeled as the troublemaker. Retaliation can be subtle in ways of not getting promoted, or you didn't get the pay increase. And there's also language in the policy that's not subtle at all. So the policy states that should an employee not comply with the additional screening measures, and I want to quote it so I'm not risking any form of misinformation, but it says, if a staff member is unwilling to comply with the screening process, staff member will be directed by a Demas officer to wait at the entrance, and the supervisor will be called. Process will be explained in the presence of the supervisor, and the staff member will be afforded another opportunity to comply. The Demas officer, unarmed, will notify a Demas police supervisor, fully armed, who will determine if a work rule violation complaint is warranted. So if I, as a Black woman, do not comply, I will have an armed police officer come to talk with me.
Now, let me clarify that. Well, are we talking staff or patients or everyone?
Everyone.
So the staff has to go through this procedure too, this conveyor belt deal. They have to go through it too.
Yep.
And they've never had to do that in the past.
No, the conveyor belt's a whole new piece of infrastructure that's coming in. And I think the huge misunderstanding from the providers and the staff saying that they have a problem with it, as I believe, and you guys, Keith and Dr. Black, you can correct me, but I think that the leadership believes that the staff had a problem with it because they didn't feel that they should be subjected to it. Like, oh, we should just be able to walk right past it, and just the patients. And so, oh, they're just complaining because they have to now go through this whole measure. And I haven't heard that from anybody. They're more concerned about the outcome on how this is going to affect and impact their patients. I mean, they weren't just complaining saying, oh, we don't want to go through it because we think we're too good. We're the providers. No, we don't think anybody should go through it.
Let me ask you a question. How do you know how effective this services business center has been? Do we have a lot of people that seek treatment there, or is it lately that they're beginning to ramp up their act, so to speak?
I love CMHC. Dr. Gallagher and I have no other reason to be in this state other than the fact that we love CMHC. We love it. That's why we're here. That's why I'm slightly terrified sticking up for what I think is right, but it's because I love my clients. I want to be a faculty member for the next 30 years should opportunity present itself. CMHC is a safety net community clinic. It has an inpatient unit, outpatient substance abuse treatment. If you're hungry, we'll give you a food card. If you're homeless, we'll help you find shelter. We'll give you a sleeping bag. Like, we do so many good, wonderful things. And I love CMHC for it. And I also have a statement from Dr. Emma Lowe, who was unable to join us, but she has a national leading street psychiatry team, where with the K2 epidemic that happened on the Green not too long ago in New Haven, the state of Connecticut cared so much about our Black and Brown communities that they funded a position for her to do homeless outreach. So instead of having clients come into the building with whatever barriers, perceptual or physical, may prevent that, she is endorsed by the state of Connecticut to go into the community to provide mental health services. So CMHC does absolutely care about our communities. They can get it wrong sometimes, and we're here because we love her. But CMHC does so much good that Dr. Gallagher and I are in the state only because we love her and its clients.
I have one final question, and another thing in your letter that struck me was the fact that they were called patrol officers were going to be patrolling the ground, and you made a statement about one is going to be armed, one is going to be unarmed. So my question is, for those who are patrolling the grounds, are they armed or are they unarmed? And are they in uniform?
I am under I believe that they're all armed. There aren't going to be any unarmed people there. Aren't they going to all have lethal weapons?
So the state police are fully armed, and they have brought in a secondary security task force of unarmed patrol officers. So now we have a double security presence as opposed to armed state police only.
And all of this is simply because it is a minority fused, so to speak, center. There's been no problems. There's been no scandal, no deaths, no murders, no shootings, or nothing like that. And it's 50 or 70, the 70 years it's been around. And then out of the blue, they have decided that this place needs security and armed guards. That's what you're telling me.
Yeah, there's been no incidents. I mean, I think we thought for a long time that the security was fine. I mean, it was doing their job. I mean, there's been no incidents. It's if you got in a facility like this and you've had very little incidents, your security is working. They're doing a great job with what they currently have, which is higher than average state buildings. But this additional, I mean, it just seems like it crossed the line. It just looks too much like prison. I mean, it looks like a TSA scanning. You're going to go to the checkpoint to go get on a flight somewhere.
Yeah, I tend to agree with you now that I've listened to all of it. It just does seem to be a little out of line with actually what has been happening. And as you say, quite excessive, not just a little excessive. in full disclosure, I've been in mental health wards, and there's no conveyor belt. There's a security guard that stands far, far, far away. His presence is really just, a white shirt and blue pants, so to speak. So I do think that this is a problem, and I certainly do wish you good luck with it. Is there anything else anyone wants to add?
No, we just want to understand, we're hoping that they will reconsider on this, going to this extent, and continue with their current security practices. I mean, they're working well, and really consider the patients. I mean, this is not about the staff. I don't think the staff, the folks who've reached out to me are like, it's not about us, it's about the patients. So, we don't want to prevent anybody. We never want to provide barriers to mental health services. That's what we all need. We're in the middle of a historic pandemic. The last thing you want to do is put up a kind of like, I don't want to say it, but a bureaucratic barrier
Yeah,
by
no, I
adding
mean,
additional
you're
security.
absolutely right. You're absolutely right. Well, folks, I do appreciate you joining us, and I actually wish I had a lot more time to talk about this, but as I said, I'm under time constraints here. But I'm also considering writing about this. I'm not going to promise because my column is already written for Sunday's paper. Is there a public hearing coming up or anything that I can? It's April 28th. Is there anything coming up closer that I might be able to highlight?
There's no public transparency or public conversations, but that's one of the things we're asking for.
There's none. You mean none? There's nothing like a public comment period or anything?
Nothing separate of our individual efforts, which is why we're here today, because we love CMHC.
Right.
Okay, but again, who is pushing this? Again, I'm confused. Who is pushing that this be done, and who is he or who is she, and what gives them the authority to do it?
Well, I believe it's both the CEO, Michael Sarniak, as well as it's got to be endorsed by the Deems Commissioner, because, you can't make this kind of big purchase, I'm sure, without getting authorization from senior levels. So,
and there was no discussion about
they've decided, I guess this, like I said, Michael Sarniak, the CEO, has decided that this level of security is needed. And like you said, there's no, which is interesting because, these state funded agencies and buildings, you think that there would be some level of public comment, but it's not built into the process. They can just do it. That's it.
Yeah, I find that's what's really particularly disturbing to me, that they could just say that this is the way we want it and that's it. No public comment, no evidence that shows that this is needed or anything like that. And are we talking about a big expense here, putting all this together? I mean, I think someone mentioned that, right? This is going to cost quite a bit of money to staff police officers, to put this technology into place. And it comes at a time when they're cutting services for mental health, patients. It seems a little stupid to me.